So welcome everybody to our CESI Inside series, our video interviews. And today I'm very pleased to welcome Patrick Fey. Patrick Fey is Vice President of CESI and Vice President of the CNV Connectief in the Netherlands. And dear Patrick, welcome.
Hello, Klaus. Nice to see you.
How do you experience the crisis? I would say both as a trade unionist working as a representative of CNV Connectief, but maybe also from a personal perspective.
Yeah, let's start with the personal perspective because keeping good health is the one and only important thing for yourself and your family and friends. And I hope that every CESI friend is also in good health and your family is also okay, because it's a big disease which we're all facing all over the world in Europe. And especially the older people are suffering a lot from it. And like in the Netherlands, like everywhere, there are a lot of people who are ill. The hospitals, there are a lot of people in it. And the government is trying to flatten the curve. That's the word. So that the spread of the disease, the COVID-19, is slowing down. That's the first thing, and we have some success, fortunately, after 6 weeks, 7 weeks of closing down society, closing down the organizations as far as possible. There are less people going to the hospitals, there are less people dying, but we're not we're not near to a solution because we need a vaccine, and I think it takes a lot of months from now till we can go back to normal. And right now in the Netherlands, our government is trying to prepare the 1.5 meter economy, so that you can go to work as much as possible, to go to shops and to meet people, but on distance. So it's safe enough, but it's more easily said than done, of course. How do you keep 1.5 meter distance when you travel by train to go to your work, or to when you have jobs where you have contact with other people? It's difficult. And for me myself, this is our home, where our older son is normally sleeping. He's a student now, but I'm working from home for 7 weeks already, and on Zoom or Microsoft Teams, etc., Skype. So it's a real new kind of working. I'm getting used to it, but I miss the contact with my colleagues, of course.
Yeah, indeed. It's been week number 7 also here in Brussels, and we see how things are evolving. Also, timid deconfinement policies are being put in place, but always, as you said yourself, this will be quite long-lasting. Right? So, particularly for CNV Connectief now, what are the particular challenges? You spoke about 150 policies. I mean, your trade union certainly has a very active role there also to play.
Yeah, we have CNV Health, and my colleague Anneke Westerlaken, she's chair of CNV Health, and there's of course a lot of work in the healthcare sector, in the hospitals, for example, and there are also problems because the equipment to protect people working in the health care sector isn't available, or is getting available, but only slowly. And at first, every kind of equipment was, of course, for the hospitals, but also for a lot of people who live in nursing homes, and people who work for the elderly. They're not as protected as they should be. So that's a problem. And we try to improve that, and when it's not safe, that we warn the politics or the employers, or go to the media, etc. So that's a big problem, of course. Also, my colleagues from the education, CNV education, because the schools were closed in March, and it was a very big shift to go from one day to the other day to digital education, which is right now in May, primary schools are starting again for 50%. So, but they've been closed for 2 months then. So that's and also our members. Some of them are very glad that they can start again because they want to see their pupils again. But of course, also some of them are afraid because they're older or having a fragile health situation that they could be infected. So that's also a problem. How can we do it, work again, but in a healthy way? And of course, the public sector, the government, is a lot of members of us. They're still working. They're needed more than ever, because in times of crisis, the government is having an essential role. So that's and we did have a lot of questions in our call center, especially the first weeks. That people were asking, how can I work in a safe way? Of course, there are a lot of problems because people who are having a flexible job are losing their job. Others are afraid that the companies are getting closed. And of course, there's a lot of unemployment expected in the Netherlands also. So that's also a big concern for us. And we are having a weekly contact with our government. So we're informed at first hand about the economic policy and the healthcare policy. And so they're seeking the trade unions, the employer organizations, so we're in this together. We try to talk about it, to find a good balance between economic growth and safe working conditions for everybody. But our economy is also facing very severe times, of course.
So, but also the advice and the assistance and the support of CNV Connectief is in strong demand, both.
Yes, of course.
From the members,
yeah.
from the workers, because also what you're trying to do right now is, of course, to bring the economy slowly back into a normal modus functioning. And of course, as you said, it is extremely, one has to be extremely careful, taking above all into consideration the needs of people to remain safe and healthy. But this crisis clearly shows that your support is basically more needed than in normal times, right?
Yes, because people are afraid of losing their jobs. People are afraid that the work is dangerous for them. And people are also having a lot of questions. My boss says to me, I'll have to take my holiday, but I'm not planning to have holiday. I can't take holiday. Should I accept this? Yes or no? So that's all kind of questions are coming to us. And our people who do the collective bargaining, they're now talking with the employers about how to reopen again the business, the organizations, how to do it in a safe way. So that's we're having a lot of talks about it. And our colleagues in the private sector, they're facing a lot of companies who are closing down, who will close down. And they're, of course, the big companies, but also a lot of small companies which are facing severe times. So, and nowadays we come from a very healthy economic situation in the Netherlands with low unemployment, but now it's rising very, very hard. So we're expected to grow to 1 million unemployed at the end of this year. So it's going very, very fast. And especially the people who are having a flexible contract, which are a lot of in the Netherlands, they're losing their jobs right now. So that's a big problem.
And what do you think will be the impacts on let's say, the long-term impacts on the way, first of all, your members are working, but second of also the question of, because now is the time, you mentioned it, also the time of the public sector in particular. Will this have long-lasting impacts on the recognition of the public sector, on the equipment of the public sector, on the way people see the public sector? What is your impression?
Yes, it should, because everybody is praising our people, and not only in the healthcare sector, of course, in the healthcare sector, but also the government, the education, etc. But that shouldn't be only words. We should. They should also have a good job next year and get paid enough. Because in the last crisis, the 2008-2009 crisis, the financial crisis, the people working for the public sector had to pay 5-6 years long for the deficit of the government. So they didn't have any wages increases, etc. And we don't want that again to happen. So we should share the economic problems together, but not the deficit of the government, which is quite raising now, shouldn't be left over to the people working in the public sector, of course. But on the other hand, you see positive things, perhaps, that the changes which should take place in a few years' time for the digital changes are now working already. More people are working from home. They're doing their job in a different way, sometimes faster, with less traveling. So they're not only problems now. We're also facing a few things. Why shouldn't we do it once we're back to normal? Some things we should save and keep doing on also.
Yeah, absolutely agree. We also, of course, here considering more, not only now, but also for the future, to use new and different devices instead of always jumping in a train or on a plane and travel through Europe for meetings, just as an example. Final message, maybe, or final question, and how far is an organization like CESI now useful for CNV Connectief? And if you could maybe close also with a short message to the CESI community to keep the spirit, that would be, of course, appreciated.
Yeah, of course. Klaus, we're in this together as Europeans all over the world. The COVID virus doesn't stop at the frontier. Doesn't make any distinction between people. So we're in this together. Every economy is hit by it. The healthcare is hit by it. So, and we can learn from each other, I think, because every country is taking, in general, the same measures, but sometimes they differ a little bit. So we can learn from each other. And also as a union, we can learn from each other, which is always one of the big good things of CESI. I like CESI very much because people who are having the same ideals and same profession as you have, how they do their job, how a trade union is working in a different country, and now in a crisis we can learn even more. And I also get very motivated by meeting my CESI friends and colleagues and discussing the important subjects which we're facing in our daily trade union work. So it's unfortunately we can't meet each other in person now before summer. We should, but I hope we can soon after the summer somehow meet each other. But we have to stay in contact, learn from each other, and also put pressure on our governments and the employers that they should do the good things for the working people. We should strengthen our solidarity all over Europe. And I think CESI is very important to that.
Patrick, take care of yourself, take care of your beloved ones, stay healthy, and thank you very much.
Thank you. Bye.
Bye. Bye.